And I thought maybe we could start, Naz, today. We'd love to learn about you, your business, and what you do. And he's kind of sponsoring today. So I'm Michael Gunther. I'm the president of the GGBA board this year. And so it's good to see everybody. I do, after we have Naz talk and we ask him questions and learn about what he's all about, we're going to break down, maybe with this size group, we might just keep everybody on and do some power pitches or matchmaking and learn about what everyone does and see what type of business you're looking for right now and if there's things that we can help get you connected. I do have to admit, I have a 6 o'clock COVID test I got to go to. So I
Uh-oh.
am going to be leaving. It's only 3 minutes from my house. So I will be leaving right before 6. So I'll just give you a heads up on that. So Naz, why don't you tell us about your company, what you do, and
Yeah. Thank
how
you
we can help
for
you?
thank you for joining before your COVID test, first of all. And yeah, the point of today's meeting is to talk about how special I am. Just kidding. So I was casually mentioning the idea of matchmaking to a couple of people at the GGBA, including Crystal, and we wanted to bringing this up to all like networks I'm in, including the GGBA. I'm going to talk to you a little bit about my business slash my medical practice, and then tell you about what I'm doing in my practice, and then just put it out there to gauge your reactions and your thoughts about like replicating that in your own way with whoever you want. So let me start this with a moment of struggle with technology, um, and find where my slides are. 1 second. There we go. Can you see my slides?
Sure can.
Awesome. Is it still working here? All right. So my name is Mohamed. I'm a primary care physician, and I've been practicing for a few years in the Bay Area. So I'm going to tell you a little bit about my journey because there really is the reason behind me starting my own business. So this is me. I grew up in the Middle East. I grew up in Qatar, in a small peninsula. It's a small peninsula of Saudi Arabia. Was born and raised, and immigrated here to come to college. So I did my undergrad, medical school, residency, and fellowship in New York, Pennsylvania, and Connecticut. Um, and initially, my vision, I mean, some of you may know, like Qatar is destined to host the FIFA World Cup in 2022, and I was selected. Somebody just joined. I hope it's Crystal. Um, I was selected to be the physician for the FIFA World Cup, and that has been the plan. So I was supposed. That's why I trained in primary care sports medicine. And in 2015, I realized that through my years of training, I'm gay. So I was like, that plan got to change right now because it's illegal. It's actually still prosecuted by the death penalty in Qatar to be gay. It's one of the few countries that still do that. So I think this is a great year for all of you to relate to what I'm saying. Did you have a moment in 2020 where you had to face your mortality and question what's going to happen and why you're doing certain things and that you may actually die? That's how it felt like. And I was like, okay, it's time to like really change things. So I fled to San Francisco and met my partner, Tommy, and decided to file for political asylum. And if you buy me a drink, I'll tell you about what it's like to file for that during the Trump administration. But so I went ahead and did that. And during that journey professionally, I decided to work in the med tech space. So I joined One Medical as a medical director, worked with them for 3 years, and worked in the San Francisco market, and then joined another Y Combinator startup, Circle Medical. And really started to learn about like the business side of medicine because I've been only training to deliver medicine in medical school residency and fellowship. I really didn't know about like how medicine works in the United States, to be quite honest. And a lot of physicians don't. And decided to do something different after I took my political asylum. It was like kind of like more purpose driven. And It really has to do with the delivery of care. So that was like, for those of you familiar with One Medical, you would know that they're really huge on the delivery aspect of primary care and like the patient experience. Um, but I decided to also focus on the cost aspect of it as well. I'll tell you, a lot of physicians have zero idea what happens when they decide a patient needs a blood test or needs a medication. We have no idea what it takes on the back end for the patient to actually get that test or actually get that medication and what it's going to cost. Because if you have like 16 people you see a day, they're all going to pay a different price at the end of the day. And it has to do with their insurance agreement. And that's like where, like, by practice, these are pictures of my office, Osra Medical, that I opened. So this is the part where it's like little technical, and I'm not gonna like dive too deep into that, but this goes into the structure of care, healthcare right now in the United States. It's employer based. And this is really where I think like a lot of the problems that we're facing come from. So it's employer based, and what happens, a lot of insurance company approach employers and pitch them, right, different products to cover their employees. And these products, like the employer and the insurance discuss really the services that the patient is going to have access to, and or decide what services the patient is going to have access to, and also dictate what metrics physicians have to adhere to be reimbursed by these insurance plans, right? And that's how patients get access to healthcare, because the insurance can cover catastrophic events as well as routine care. And the routine care, most of the time, is what covers labs, meds, and imaging. And all of that is linked now to the insurance, which is linked to the employer. And what happened over time is, like, you can be, if you're a business that sells Band-Aids, I'm going to just use Band-Aids as a random example, and your Band-Aids cost like 2 cents to sell for a profit, the insurance company would approach you and say, we're going to bring you so much business, more than you can handle, but your Band-Aid now is worth $200. And you may not legally sell it for 2 cents anymore. And that's what happened with everything related to healthcare, unfortunately. So now your labs, meds, and imaging costs are like 10 to 100x sometimes. And it's more than what the vendor actually needs to charge to make profit, but they're legally bound to the agreement with the insurance company. So there is a model that's really thriving a lot more outside the Bay Area than it is in the Bay Area. And that model is called direct primary care. And what direct primary care aims at doing is breaking the chain and decoupling routine care from the insurance company to the patient directly. And what you do by doing that, like, yes, your costs. So now, like, for me to be able to do that, to practice in this model, I had to opt out of everything, right? And I had to opt out of the whole system. So I cannot be reimbursed as a physician by any insurance company. And the patient has to pay my fees. But my fees can be really low. Outside the Bay Area, people are charging $40 per month for unlimited primary care access. Because in the traditional model, that's about how much I make actually per visit. Like, when you take out like the admin cost of running fee-for-service practice and billing and all the layers to navigate the system, that's your take home. So we can actually just cut all of that out and just charge that, and we would still be making the same. And so in the Bay Area, I can't afford that because rent. So I'm charging charging a little bit more than that. But I charge the cost of an office visit. So I charge $200 to $250 per month for unlimited doctor visits per month. And what the biggest perk now, and I have this dotted line here because people that decided to scale this model have signed up companies. So they would go to the company directly and say, you can pay us per employee per head, and we'll take care of them for free, and we'll have an on-site clinic, and we'll really reduce the cost of care for your employees. And I'm not going to talk too much about that. And it's actually really good for the company that's going to grow long-term, because what happens, there is this mystery formula insurance companies have that basically comes at the end of the year and tell you as a company, now this is your new premium based on the utilization that you had the prior year. Well, a lot of this utilization comes from routine care and primary care and using like routine services. If you remove it and just have a direct pay for 90% of the care, your insurance premiums actually stay really low in the current setup. So what ends up happening is that you end up reducing the labs, imaging, and medications cost by 90%, like basically in the primary care setting. So if you look at one example of somebody, I'll give you like something that's not unusual. 43-year-old male on a blood pressure pill that wants finasteride for hair loss. We were talking about hair earlier. I tell them to just own it personally, but some of them want finasteride, so I just give it to them. Um, and occasionally wants Cialis for erectile dysfunction. So if you have this person that's like a really typical case that comes in and really try to break down the cost of their care through a model like mine versus the traditional model, you will see that the cost saving over time, and this is just like for one condition, right? Like over time, it really makes a huge saving for the patient. And a lot of the saving comes really in the blood work, medications, and some imaging, because the copay sometimes to these services through the traditional model is more expensive than how much they cost, like actually, if you get them on wholesale price without affiliation with insurance system. So this is the little ecosystem that I created conveniently right before the pandemic hit. So it's been a really amazing journey. And I put it out there thinking about the cost saving aspect of it, right? But the reality is I created an independent model, right? And I just put it out there. And it's been really interesting to see really who has been knocking on my door, right? So everybody that didn't fit in a traditional medical system for any reason, like ended up coming to me seeking care. And you could be somebody that's a transplant patient. You could be somebody with a mystery diagnosis that specialists just keep bouncing and not knowing what's going on with you, right? You could be somebody that like decided to come out. And that's like the main reason I wanted to create this, right? Like I was thinking of the LGBT community and my personal journey. I wanted something that's more intimate, safer, slower, without a lot of exposure, with a lot of privacy. The privacy aspect has been really important too, because another perk to this model is no billing trace to insurance. So if you're a professional in a sensitive position with mental health illness or any condition that you may be stigmatized for, you can come and seek the care from a model like this, and there's not going to be trace, right, anywhere in the system that you're being treated for that condition, because everything is centralized in my office, right? From the doctor visit to the medication to the lab, everything is done. Currently, I'm the pharmacist, the phlebotomist, and the doctor. Not sustainable. So I'm gonna have to figure this out eventually. But currently, I'm doing everything on my own. So the part of the matchmaking part, so this is the part where like we're gonna do. Another part of my practice is my sponsored program, because now I have this channel where I can offer access to meds, labs, and imaging at a massively discounted rate. So I have sponsored spots in my practice where I give asylum seekers, artists, and self-employed people free access to my clinic. So they don't pay me their monthly membership fee. They have the unlimited access to me. I give them my cell phone. I can take care of them for free. And when they need labs, meds, and imaging, they can access it at the massively discounted rate. So that's like basically that's how I make a huge difference in like those few individuals' lives. And one of them wanted to have like a formal collaboration with me. So she's like now one of the faces of my practice. She's a local drag queen, Yves Saint Croissant. And she is like one of the first people I started doing the matchmaking, because I think of her as a business owner, right? She's an artist and she like runs her own shows and was very impacted with COVID-19, right? So when she like learned about my practice and reached out and started using it, she also had a pitch, right? She was like, well, if you also let me use your internet and use your extra exam room that you're not using back there so I can do my Zoom drag show, I can mention your practice to my clients. And I was like, that sounds awesome. Let's do it. And we did some of it, and it's been awesome. And I love collaborating with her. We're doing different things together, and it's been a partnership. And this is really like what started this whole thing. So when I mentioned this I thought it was a very rewarding experience for me to do that. And it just got me thinking, why not reach out to all the networks I'm in, including the GBA, and just ask people, like, what are your initial reactions about that? Because, like, to me, my craft is medical care, and I could provide that to somebody. And to me, it's a relatively like easy thing to do, right? Like, they're just one more patient. But to them, it's like a huge burden lifted. And I don't know, like any two random people here could be me and Eve St. Croissant, right? Like, how can you make a difference to somebody else on this Zoom call and really make a dent in their like journey running their own business, especially in the face of the pandemic right now? And vice versa, like what else, what are you desperately in need of that you can't really afford or manage on your own right now that you could really use the leverage with? So that was the main thought really behind having me like sponsor this matchmaking meeting, just to put this on the table and like see what your thoughts are. Like, is this something you're interested in? What are your thoughts? What's your hesitation? And kind of just take it from there. Hi, Crystal. I see you here on the call now.
Question.
Yes.
Are you suggesting that we be doing the matchmaking now, or that we start planning to do the matchmaking in the future?
I mean, it's really we're brainstorming, right? So that's what this is. We don't have to do it like right now before you leave. You have to find your match kind of thing. No, it's like putting the idea on the table, right? It's like, what are your thoughts on it to start with before even suggesting anything, right? Like, do you think that doing something like this has unforeseen consequences, or do you think, do you think, like, what do you think? Like, I'm just putting it out there.
Well, I'm.
The...
Oh, go ahead, April. That's fine. I yield.
Thank you, sir. I don't know necessarily about the matchmaking. It's an interesting idea, but I love the idea of your practice. I love what you are saying. I'm like ready to have you be my doctor now. Immediately. So I am a recruiter, and I've done a lot of recruiting for insurance companies, and I have seen like secondhand, because of the positions that I've hired for, and just hearing from people who go to work at these big insurance companies, just the nightmare that it is. But you just broke it down so succinctly. I think everything that's kind of needs to be fixed, and I think it's great seeing you do that model. So I'm really glad to have gotten introduced to you and your practice tonight.
Thank you. Appreciate that.
So I'm kind of slow when it comes to things like insurance. And I'm not quite sure that I understand, like, if you had a hospital trip that I needed to have a surgery done in a hospital, like who covers that? I love the idea of paying a doctor a monthly fee to be my GP, but then I don't understand where, if I have an emergency services, where that comes in.
That's an excellent question. So let me see if I can pull the slide back real quickly. It is a little confusing. So I'm going to go back a little bit here. So the thing with insurance is that it has both the example you mentioned is a catastrophic coverage event versus routine care. And I think, well, I know keeping these two together lumped in under insurance, one insurance coverage, it drives costs up a lot. I try to come up with a lot of good examples. I'm still working on that, but it's kind of like having your car insurance covers washing your car or vacuuming your car. You can't vacuum your car without insurance. Like, every time you vacuum your car is utilization, and then your car insurance premium goes up. So it's kind of like similar to that. It's like not quite that, but like it's very, very similar to it. You do have to have insurance. You can't not have insurance. You
Right.
always need to have insurance, but your insurance should be for catastrophic events. And some specialists now are actually going out of this. I met an ophthalmologist in Oklahoma that is performing really complex eye surgeries, including a subtype of cataract surgeries. And she opted out of insurance as a surgeon. And you would think that that's going to break the bank, right? Not at all. So she showed us the itemized bills for her cataract surgeries pre and post opting out. Before opting out, it was about $50,000, like as a cost for inpatient stay and the surgery and anesthesia and all of that. And her cut was $500 out of that 50,000. So she went and outsourced everything for cash price on wholesale. So now she does her cataract surgery for $900 and she takes $650. So she's making more actually doing it for $900. And the anesthesiologist was like $100 for like putting somebody under for like 15 minutes. Yes, I'll do that. That's easy. So it just shows you like that it really is inflated unreasonably. And it's like, where does that inflation go? And it's like, you have this cover of, or like you just have the false perception that you're going to be covered, basically, right? Like they say, this is your premium and you're going to be covered, but you're not. There's like so many things that are not covered. And when they're covered, your copay is so massive that it's like, what's the point of paying this monthly premium? Like that monthly premium should be for the catastrophic coverage. If you have an ICU stay for 2 months in the hospital, then yes, let's use your insurance. If you need routine meds and have a cold, you shouldn't go and pay like $500 for like,
Sure.
10 minutes with somebody to just tell you have strep throat. And
Right.
then pay like, I don't know how much for penicillin, and I don't know how much for the labs and for the swab and like all of these things, right?
So if I'm hearing you right, what I hear you say is that you would then, so I get my insurance from my employer, and recently I found out that the doctor is no longer covered through the medical group, so I had to find a new GP. And I'm kind of like being pushed around in the system. And I realized that insurance companies are super hard to work with, actually. So what I wonder is, how do the patients that you have, how do they manage, what health groups are you working with? What insurance companies do you work with to insure for instance, foot surgery, or which is maybe outpatient, or it's an overnight, or something that's done in a clinic, but is a specialist. Like, what kind of insurance companies do you work with? Or does Osra Medical have a group of people that are specialists in different fields? And do they have those resources here?
Yeah, that's a good question. So I'll tell you, so I don't work with any insurance company. I don't get reimbursed by any of them. So I can work with any of them. They still have to accept my orders as a physician. So that's like a huge perk to what I have. So what happens right now is that like what I deliver to each person is different. So I'll give you an example. I have somebody that's on a really good PPO plan that had an unknown diagnosis, got several strokes, episodes of blindness, saw 7 specialists, couldn't breathe, needing oxygen, basically crashing, and nobody knows what's happening, and he was just being passed around. And their internal medicine visits are half-hour long, which is not enough. So that's why they came to me, because I can spend more time with them. They now have double lung transplant, and they had sarcoid. That was the issue, and it was an undiagnosed thing that was going on, and nothing changed in their system. So they were on United Healthcare PPO. I cannot use an HMO plan because an HMO plan like Kaiser or any HMO plan by definition require you to stay in network, or they will decline all services. So if somebody has a PPO like him or Medicare, they can come to me still, and then I do the shopping for them. So like he needed a scan, a PET scan. then I would go and submit it through United Healthcare and see if I can get it covered. But if it's not covered, I'm not going to say, too bad, you're going to have to pay the PET scan rate at the same rate that insured people get it, because that's what happened in the traditional system. If you need an MRI and the MRI is not covered, you pay the full price of the MRI, which is like thousands of dollars. Cash pay MRI with me is like $390. So you don't have, so you can just cut that, not go to the insurance. You can literally leave my office, go to the radiology facility and pay $390 and just get it done. So for a lot of people, some people are coming here just for the convenience part of it. They're like, we don't care about like these marginal costs. We're just gonna like cut to the chase and just get these services done. So some people are doing that. But what I'm doing right now is I do the shopping for each person to see for each service that you need, does your current plan actually offer a better deal and better coverage, or are you better getting it on wholesale price through me? So I do have some people that don't have insurance, that choose to not have insurance, which I think is a bad idea, but they're not insured. So if you're not insured, for sure, this is the most cost-effective way to get care. But if you have a PPO plan, this can be a good addition depending on what you need, right? If you don't utilize care at all, like if you don't see the doctor, then maybe not, right? Like, but if you have one or two chronic conditions, the cost equation really immediately flips to utilizing a model like this.
Right. Thank you. That's helpful. What I found is, like, when I was shopping around at my age, when I'm shopping around for health insurance, it's extremely expensive to go independent of my employer's plan. So I don't know what kind of plan I would need to get that would supplement, what the services are that you would provide.
You can reach out. I can brainstorm with you.
Yeah,
like I wouldn't, if you want just to brainstorm and see what's good for you, I can just like.
Yeah, and I don't mean to take up everybody's time to discuss my specifics, but I thought that there might be some interest in, just kind of those general questions. So.
Yeah, I'll put my email in the chat. If you just want to ask questions about how to access care for yourself, I'm happy to give that for free. Like, you don't have to.
Yeah. What I'm impressed about is the medical care system here is really broken, and
yes,
it's so complicated, and there's a lot of things in the way. So I really wanted to join tonight's meeting because I was just really curious about what your medical model looks like, and it seems very sensible. So I love it, and I applaud you for that. So
thank you.
All right, y'all. I'm a little late jumping onto the call, but we have a little bit of time left. So if you have questions, please take down Naz's contact information and set up a one-to-one with him. But I'm thinking maybe we can break up into some smaller breakout rooms and maybe talk about what our businesses entail. So if there is any, seeds of matchmaking happening, then we can set up one-to-ones later on. So does that sound okay with everybody? Okay, better, because that's what we're doing. So give me just a second. And I'm going to put you some rooms. We'll give you about 5 minutes to chat, maybe a little longer. We'll come back and then maybe we'll mix it up again. So thanks, guys, for participating for tonight. One thing I wanted to just GGBA announcements is that some of you may be familiar with our Power Pitch program that we've had in years past surrounding the Power Lunch. This year, we're changing it up, of course, since everything's virtual. And what we'd like to do is give our pitchers some coaching like we have in years past, but then use a production company to produce videos that we can then post on our website for our supplier diversity folks, and then boost on Facebook and stuff like that too. What we're doing in addition is conducting interviews with people who do the pitches and also recording those. So giving y'all lots of content to put on your website, share on your social media, and have us boost it too. So we're trying to get our members exposure. So if you think that's something that you want to know more about or think you might be a good fit, make sure you reach out to us. You can reach me at vp@ggba.com, and I can put you in the funnel. Our goal is to get 20 pitches recorded and on the website before May, before our Power Lunch. So that's
fantastic. All right.
Yeah. Of course, these days it doesn't take much to get me excited because there's not a lot going on.
Ain't that the truth? Except unless you're passing by Twitter, and then there's all sorts of interesting things going on.
Fair. That's fair.
One
Yeah.
interesting thing going on, I hear.
One protester?
One person of protest, or is that just somebody passing by?
I was on my Twitter last night, and they told me, to get Trump and Pence out of office, and I was like, that sounds good.
Yeah.
So,
Count me in.
Not going to be met with too many objections to that, I think, these days.
Only one more week,
Yeah.
right? Only one more week.
Yes.
Which is unfortunately enough time for lots of bad things to happen.
Sure is. Yeah.
looking to the future, I know the NGLCC is putting on an event surrounding the inauguration of the incoming administration. So it's in our last newsletter that went out this morning. Encourage everyone to attend that to maybe help process everything that's going on. Our February Make Contact is going to be about B Corp certification. So we'll have someone who's an expert on the topic matter come in, and of course they'll be networking as well. So keep showing up, keep networking, meet folks. This is how we're doing it these days. So lovely to see you all. Hope you have a good night.
All right.
Thank you, Crystal.
Thank you, Crystal.
Hi, everyone. Good to see you.
Bye, everybody.
Bye, everyone.
Bye.
Bye.